Welcome to Group 2's Grand Nursing Theorist presentation on Jean Watson, the founder of the theory of human caring. Dr. Watson is a distinguished professor and Dean Emeritus of the University of Colorado College of Nursing. She was the founder of the Center for Human Caring, Fellow of the American Academy of Nursing, past president of the National League of Nursing. She's also founder and director of the nonprofit organization, the Watson Caring Science Institute. In 2013, Dr. Watson was inducted as a living legend by the American Academy of Nursing, its highest honor. Born Margaret Jean Harmon, June of 1940, in a small Appalachian West Virginia town, Dr. Watson credits her upbringing in the small, cohesive town of shared values and being the youngest of 8 children as a major influence in her interest in human complexities and interactions. She paid attention to what was going on around her in terms of all the human dimensions and complexities of life. Losing her father suddenly at age 16 gave her experience with dealing with loss and grief and inspired her to go to nursing school. She married in 1961 and gave birth to 2 daughters in 1963 and 1967. Dr. Watson attended the Lewis Gale School of Nursing in Roanoke, Virginia, graduating in 1961. She married Douglas Watson that year and moved to his home state of Colorado. While raising her daughters Jennifer and Julie, she pursued and earned her Bachelor of Science in Nursing, master's degree in psychiatric mental health nursing with a minor in psychology, and a PhD in educational psychology and counseling, all from the University of Colorado Boulder. Dr. Watson admits that early in her nursing career, she felt inspired by the relationships and human connections with her patients. She felt there was never any attention or voice given to these human dimensions, despite the fact that these relationships were very rewarding both to the patients and the caregivers. All the focus was on treatment and cure. Through her education and travels around the world, she discovered that nursing is not a subset of medicine. It has its own science. Nursing science has a meaningful philosophical foundation about humanity that runs parallel and complementary to medicine science of treatment and cure. This realization led her to her first book, Nursing, the Science and Philosophy of Caring, which evolved into a model of caring science. In 1997, Jean experienced a golfing accident that led to the loss of her left eye, followed by the death of her husband in 1998. Watson stated at this time that she was attempting to integrate these wounds into her life and work, and that one of the gifts through suffering was the privilege of experience and receiving her own theory through the care from her family and loving nursing friends and colleagues.
I'm Jean Watson, and I'm delighted to be with you. And this is such a special, privileged topic because it really is sacred work that involves this caring theory and this caring science at a deep moral and ethical level that really embraces the wholeness of our humanity and the sacred circle of life and death. And as you would attempt to relate the caring theory and the caring science work to the whole process of death and dying and the deathing experience that would be compatible with this deep ethic and sacred work of caring and healing, you might rethink the meaning of healing in relation to dying. Because in a conventional way of thinking, a person may have disease and be cured, but they may not be healed. But in a model of caring science and the theory of human caring, the other side may occur that someone may not be cured, but the deathing experience may be the ultimate healing experience. If we hold the consciousness and we hold the caritas field, allowing for this sacred circle. And I'll use an example of the indigenous people, Native American, the First Nations people of Canada, the Aborigines of Australia, the Maori of New Zealand, is that all of life is a circle. And that belief system that holds a deeper, ancient wisdom, perennial view of our humanity and our being in the world is that we all come from this spirit world, the non-physical world. We all come from that field in the universe that some have referred to as the infinite field of universal love. But we all come to be on the earth plane for a given time, maybe for a given reason, to fulfill our soul's journey, our purpose for being here. And what a privilege to be able to discover your purpose.
Watson has authored or co-authored over 30 books and publications. Publications reflect her theory of caring from her ideas about the philosophy and science of caring. In 1988, Watson used the concepts from the works of Nightingale and Rogers to influence the development of her theory. Concepts by psychologists Johnson, Georgi, and Koch helped her to develop her theory on conceptual and empirical problems in nursing. She emphasized the need to enhance interactions and promote health, wellness, and mental health. Born in 1940, Dr. Watson has lived through some major life events, including but not limited to the ending of World War II, the civil rights movements, and the women's rights movements. The nursing process in Watson's theory includes the same steps as a scientific research process: assessment, plan, intervention, and evaluation. In applying the 10 clinical Caritas processes, the nurse becomes an active co-participant with the patient. Despite the theory's complexity, most find it easy to understand. The 10 curative factors provide guidelines to nurse-patient interactions and equip nurses with the most satisfying aspects of practice while providing holistic care. Watson's theoretical concepts may help nurses and their patients find meaning and harmony during a period of increasing complexity. Simply put, patients are more than their illness. Caring promotes health better than medical care alone. Nursing requires a holistic approach by incorporating spiritual dimensions to promote growth, healing, and acceptance. Jean Watson's theory incorporates the meta-paradigms of person, health, and nursing. Watson views a human being as a valued person to be cared for, respected, nurtured, understood, and assisted. Health is unity and harmony within the mind, body, and souls. It is associated with a degree of congruence between the self as perceived and the self as experienced. Nursing is a human science of persons and human health and illness. Experiences are mediated by professional, personal, scientific, aesthetic, and ethical human care transactions. It incorporates holistic care, and its aim is to promote health, prevent illness, care for the sick, and restore health. The actual caring occasion involves actions and choices by the nurse and the individual. The moment of coming together on a caring occasion presents the two persons with the opportunity to decide how to be in the relationship. Major concepts include Watson's 10 curative factors, transpersonal relationship, and actual caring occasion. Watson's 10 curative factors: number 1 being the humanistic altruistic system of values. What is altruism? Formation starts in an early age with learned values from with parents, influenced by life exposure and experiences. It is necessary for the maturation of the nurse in promoting altruistic behavior. Number 2 is faith hope. It is to provide a sense of well-being through meaningful beliefs of the individual when things are limited. Number 3 is sensitivity to self and others. It includes development of one's own feelings, encourages self-growth and self-actualization, and improves relationships through authenticity. Number 4 is developing a helping, trusting, caring relationship. It is communication characterized by congruence, empathy, and warmth. Number 5 is expressing positive and negative feelings and emotions. The consideration of all feelings, thoughts, and behaviors is necessary for a caring relationship. It allows understanding. Number 6 is creative, individualized problem-solving caring process, where scientific problem-solving allows for control and prediction, a systematic use of creative problem-solving caring process. Number 7, transpersonal teaching learning. Understanding of how one learns or teaches can be helpful in a caring relationship. Plan based on how one perceives. Number 8, supportive, protective, and/or corrective mental, physical, societal, and spiritual environment. It is for providing safety, privacy, and comfort, as well as being able to change external and internal variables to help the well-being of the person. Number 9, human needs assistance. It is a hierarchy of needs similar to Maslow. All levels of needs are important and valued equally. Number 10 is existential, phenomenologic, and spiritual forces. It is understanding from the person's perspective and frame of reference and assisting the person in dealing with life issues. As character factors evolve within an expanding perspective, and as her ideas and values evolved, Watson offered a translation of the original character factors into clinical character processes that suggested open ways in which they could be considered. Transpersonal relationship is the intersubjective human-to-human relationship in which the nurse affects and is affected by the other person. Both are fully present in the moment and feel a union with the other. They share a phenomenal field that becomes part of the participant's life story. Actual caring occasion. This is the concept of the theory that focuses on the moment the caring nurse has that connection with the patient in which the nurse can now have an impact on the patient's life. Usefulness. This model has been adopted throughout hospitals. It acts as a framework for nursing activities. It has been used in development of educational texts as well as educational models for nurse educators. It is a guiding principle for interacting with people and has been helpful in the establishment of caring projects. Many schools throughout the world have utilized Watson's model in their nursing curriculum, including but not limited to the University of Colorado School of Nursing, School of Nursing at Georgia Southern University, as well as schools in Scandinavia and Japan. An example of patient cases using Watson's theory can be seen with in vitro fertilization. Nurses used Watson's theory of caring and her 10 character processes to help infertile women regain hope after failed attempts of conceiving. Included in this is a 2019 study titled The Current Intervention Studies Based on Watson's Theory of Human Caring, a Systematic Review, published in the International Journal for Human Caring. Its purpose is to examine how Watson's theory is helping nurses, patients, and nursing students to improve performance, patient outcomes, and experience. The study sampled 19 caring intervention studies from 2005 through 2018, a systematic review of literature about the current intervention studies based on Watson's theory. The authors utilized narrative synthesis for the variety of intervention approaches and study designs. The key findings were, in patients, decreases in anxiety, depression, distress, pain, and hopelessness, with increases in self-confidence, ability to cope, optimism, self-efficacy, as well as emotional and spiritual well-being. Nurses showed increases in satisfaction of workload and coworker relationships. New grad nurses with increased confidence in their nursing roles, greater competence prioritizing patient needs, and higher proficiency in communication with patients and their families, also adding excitement to their nursing career. Nursing students report positive effects and increases in caring knowledge, confidence, and behaviors among intervention groups. According to McEwen and Wills, Watson's theory is parsimonious with only 10 character processes and 6 working assumptions. A study published in 2009 in the International Journal for Human Caring titled Caring Defined, a comparison and analysis, reports that Swanson's middle-range theory of caring is based on Watson's theory. It is derived from studying the care of women who were pregnant and women who experienced miscarriage. The purpose of this theory, to define caring in the 5 essential processes: knowing, being with, doing for, enabling, and maintaining belief. Knowing, to strive to understand an event, is similar to Watson's character process number 6. Being with, being emotionally present, is similar to Watson's caring process number 2. Doing for is doing for the patient as they would do for themselves if they were able, is similar to Watson's character processes number 9. Enabling, facilitating the patient through life's transitions with care unfamiliar to them, is similar to character processes number 7 and 8. And maintain belief, sustaining faith, helps patients get through the process, which is similar to Watson's character processes number 1 and 3. This is a beautiful graphic to conclude our presentation showing the theory's use in providing high-quality healthcare with the emphasis on the caring relationship. Thank you for your time.